So this is the 5-point cheek reshape injection technique guide for the cheek reshape. Cheek is, we do start, as I mentioned before, that cheek is the, or the mid face is the starting point for any of the indications in the mid face or the lower face. Yeah?
Yeah.
So in 5-point cheek reshape, we have actually, just a second, give me a moment. Yeah. So in a 5-point cheek reshape, we have 5 points basically: CK1, CK2, CK3, CK4, and CK5. Right?
Yeah.
Is there any confusion? Like you're looking a little confused.
No, I was trying to remove this from the side, this window that's coming.
Acha.
It's occluding this
Okay.
half of it. I was trying to make
Is
it
fine now?
minimize it. Because it's coming on in the middle of that
Okay. So
screen.
there's a black
Yeah, no, it's better. No, it's better.
done.
Yeah, it's better. Yeah.
Okay. So in 5-point cheek reshape, we have 5 points: the CK1,
Yeah.
CK2, CK3, CK4, CK5. Initially, they were called as L1, L2, L3, and there was no CK4 and CK5. But now, after
Yes.
M-codes, it's like cheek 1, 2, and 3. So now CK1 is the zygomatic arch. This is a zygomatic arch. This aims at supporting the ZCL, or the zygomatico-cutaneous ligament, from beneath. Now, according to Dr. Arthur Swift, how is this lifting achieved? Like if this is the bone and this is the ligament. If this is the bone and this is the ligament is going down like this because of bone resorption. Right. So
Yeah.
it's like open door technique. Like if you fill something at this hinge, at the hinge point, if you are filling something, so it will lift the ligament upwards, right?
Yeah.
Which is why when we inject the zygomatic arch, we pull up the skin, we palpate for the suture line, and then inject on in front of it and behind it. These details are coming in the next slide. So first is the CK1. CK1 is basically 3 points. They're not 1 point. CK1 is a region. It has 3 points. Then CK2 is zygomatic eminence. Now this is the point exactly where we find the festoon or the malar mound, zygomatic eminence.
Yes.
Then CK3,
yeah, got it.
Yeah, CK3 is the anteromedial cheek, this area.
Yeah.
Then CK4 is the lower lateral cheek or the parotid area. And CK5 is the submalar area. So these are the 5 points which we use for a 5-point cheek reshape.
Yeah.
So these are the points as mentioned on this thing, when we see it on the layers of the face. In this, the CK3 and CK5, they are the alert zone, because CK3, the anterior malar, has the infraorbital foramen and infraorbital arteries and nerves coming through it, and CK5 is it comes in the course of the facial artery.
Yes.
So 5 point in CK1, how do we do? It is like active numbers are 0.1, 0.1, 0.1. There are 3 points. So total 0.3 for CK1. Right?
Yeah.
You lift the cheek.
Point.
Yeah, lift the cheek. Now, how to identify? So here we use we draw 2 lines. I think they're called Hinderer's line.
Yeah, Hinderer's line.
Lateral canthus to the lateral corner of the mouth, we draw 1 line. And one is from the lateral nasal ala straight to the tragus. This is the second line.
Yeah.
So this divides the entire cheek area into 4 quadrants. Right? This is a circle marking. So the medial upper medial is the anterior malar. The upper lateral is for the CK1 point. The lower lateral is the CK3 point.
Okay.
lower lateral is CK4 point and medial is CK5.
Okay. Yeah.
These are the 4 quadrants, right? And so when we talk of CK1, that is the zygomatic arch. The product here we always use is Voluma by default.
Yes.
No other product. It has to be
Yeah.
hard, rigid, and high G prime product, right?
Yeah.
And the delivery is the volume is 0.1 is minimum and 0.3 is maximum, but it is usually 0.3. 0.1 is per point. So
Point one.
minimum dose, yeah, minimum dose for CK1 is 0.3. Now here
Fine.
this does not mention the maximum dose. The maximum dose is 0.5 in one session.
Yeah.
Right. So if I have a heavy face, for example, for my face, see all these parameters, they have been designed for Caucasian faces, which are slim faces and long faces. For Indian faces, slight modifications have to be done. For example, for me, I take minimum 0.5 ml per side to get a good shape because my face is heavy. So if I get 0.3 done, I'm not very satisfied with it. I'm not very happy with the result. But when I got 0.5 done, I was like, wow, this is like good for me. So the heavier the face, the more the product is required to lift up the.
Got it. So how do you distribute 0.5? Like 0.1, 0.1, 0.1 is point for
No.
0.3.
Huh.
So
So
how do
for
you, there are 3 points.
0.2, 0.2, 0.1.
So the 3 points is one in front of the junction and one behind and one directly on junction.
Yeah, right. So first lift, then feel the suture line, inject
Suture. Yeah, suture.
behind it and
Yeah.
in front of it. 0.1 centimeter above and lateral and 0.1 centimeter below and medial.
The suture. Yeah.
Yeah, the sutures. So you can easily palpate the suture. Some faces, like heavy faces, edematous faces, faces with malar festoon, you might not be able to, feel the suture. And in heavy faces, it's very difficult to feel it. But then there's a indirect approach that draw a line from lateral canthus to the tragus, and somewhere on that line lies the suture, upper end of the suture. It's a rough, surface marking guide, in case you're not able to palpate the suture.
Yes.
So,
yeah.
So somewhere along that line.
Yes.
So
Got
the
it.
device, the device that we use for this is a needle, always, right?
Yeah.
Cannula is used when we want a top model look. Now we have models coming for cheek lift. Now, the 2 indications will be there. One is a young patient who is coming for, facial feature contouring and all that. And one is an, senior age group person. They are coming for anti-aging. So if you're doing for anti-aging, it could be 0.3, 0.5 with needle. But if they're coming for cheek contouring, a model who wants a, top model look kind of a thing. So for them, we plan like 0.3 with needle, 0.1, 0.11 with needle, and then 0.2 in the first session, and in the second session, 0.5 with a cannula in the superficial plane.
You mean 0.3 with needle like the classical way and 0.5 later on in subacute plane?
Yeah, in subacute. So that is total 0.8 ml. And that gives a very good top model look. But don't do it in the same session, divide it. So the second session, 0.5 could be 0.3 also, depending upon the face,
Yeah. That will also volumize it.
Yes, volume. That will only give a sturdy, shape. We can use Ultra Plus XC. See, all the products can be used for all the indications, right? But if we use the right product, which is mentioned as per the MD codes, then the longevity of the results is greater. I can do 0.1, 0.1 in this area with Ultra Plus XC also. That time the results will be very good. For 6 months it will be good, but after 6 months it will be gone. With Voluma, if you do, it might stay for 1.5, 2 years. So only
Yeah.
the difference is that the longevity of the results will be there only if you use the right product for the right plane and right indication according to MD codes.
So the 0.3 you are giving Voluma, and then 0.1 subcut you are using Ultra Plus XC.
We can use
Ultra,
Voluma also, we can use Ultra Plus XC, both. But the longevity for the results will be with Voluma and not with Ultra Plus XC.
so
Ultra Plus
what is the advantage of Ultra Plus XC? Because I
it's
think
more
it's a lighter
economical.
product.
It's a more economical actually. It's when you are playing with price points, no, the selling part, the that
Okay.
low budget models are with low budget.
Okay. Okay.
So when you
Price.
are
So
treatment planning,
less.
yeah.
Yeah. And does Ultra Plus also soaks water? Does it shape changes with 3 days? Voluma does change.
Voluma,
Ultra Plus.
yeah, Voluma absorbs less compared to Ultra Plus. Ultra Plus XC is very hydrating.
Hydrating. There's more hygroscopic.
Yes, it is more hygroscopic.
So that means what we are seeing the shape when we fill, in 3 days it might become little
Yes.
even
So
more
always
prominent.
undercorrect. Always undercorrect. And undercorrection means the minimum dosages which are mentioned in MD codes is for undercorrection only.
Okay, undercorrect. With Ultra Plus, we have to undercorrect.
Yes, because Ultra 3XC swells up, Suppose if I have a person.
I am not.
Yeah.
I have not used Ultra Plus XC. I have used Voluma and Volite and other products, but not Ultra Plus. I have never used it.
No, Ultra Plus is a good product. It can give results for 6 months, 6 to 8 months, it will be good. But then not beyond that.
Okay.
Because it's a softer product as compared to Voluma and other.
So it is more easily moldable. You can mold it more easily, but it will gain more water at the same time, but it is more easily moldable.
Yes.
Good for lips, no?
No. Lips, Volift is fine because with Ultra Plus XC, they swell up a lot. As it is, after lip filler, there's swelling. When you use Volift, there's a lot of swelling after 3rd day, 4th day, and people sometimes they are not able to carry that kind of a look even for a day. If it's a model, then it's a totally different, perspective. But otherwise, an office-going person, a housewife, they cannot afford to have swollen lips even for a day. So in those cases, it's better to avoid Ultra Plus XC because that hydrates a lot. It swells up a lot. Volift is fine.
Yeah, got it. Yeah.
Similarly, for under eyes, never use Ultra Plus XC because it's super hydrating. And under eye is one concern where, first of all, direct approach should not be there. Always do cheek first. And second, never correct, always undercorrect on table. Because after 3 days, it's going to, blow up.
Yeah, that's right.
So the device is needle, the delivery is boluses, the structure is periosteum on the bone, CK1 on the bone, periosteum. Alert zone is zygomaticofacial artery. According to one study, in few percentage of faces, zygomaticofacial artery is the dominant artery of the face rather than facial artery. So this we saw in a cadaver course where the zygomaticofacial artery was the dominant artery of the face and not the facial artery.
Yes.
And this artery runs just beneath the arch. The zygomatic arch, just beneath. And in my case, it is just on that CK1 point, when I got Volumina, that was a zygomatico which was ruptured and I had a bruise over here. So.
Yeah, sometimes it can come on the bone also, you mean?
Yes.
Instead of being under the bone.
Yeah. I am an example of zygomaticofacial artery on the bone.
Okay. Yeah.
So always lift the cheek. So what will this point do when you inject, when you're done with CK1, you will see improvement in the eyebrows also. Shape of the brow will also improve. little bit.
Yeah.
It will give support to the eyebrow. It will give support to the lower eyelid also. It will improve tear trough. It will improve the smile lines or laugh lines or marionette and nasojugal grooves. And it will improve the jowls also. So these are the multiple benefits of just injecting CK1.
It is like anchoring point and lift point.
Yeah, anchoring, lifting both. Right?
Yes. Yeah.
So this was about CK1. Then second point is CK2, zygomatic eminence. Right? So
Yeah.
again, the product that we use for this is Voluma. The minimum dose, here we do the minimum dose 0.2 to 0.4 ml, small boluses. The device is needle, delivery is bolus and on the bone, supraperiosteal.
Yes.
Right. Now, this is a point where models apply highlighter, so that they can get a more good picture. It makes the face, this point makes the face more photogenic.
Yeah.
So if young patient, good, they'll get good results. For elderly or senior age group, just rule out the malar mound or festoon, because if in case the malar mound is there, filler can, aggravate the mound.
So what do we do in old age? Do we put
Senior age group,
or not?
senior age group, you just inject beneath the mound, beneath the festoon. You draw the boundary of the festoon and beneath it, you go like this. Instead of going like this, you go like this. You lift the face
Yes.
and go like
Yeah.
this. The lower border of the zygomatic arch. Right? And
But we normally go perpendicular. We normally go perpendicular in this
yeah,
directly.
but in festoon, if we go perpendicular, we're directly injecting beneath the festoon, because of which the festoon will become more prominent. So we don't want to deliver anything beneath the festoon.
Okay. Then how do we go?
We just go slightly on the lower border, mark the lower border of the festoon, and beneath that you inject the bone, on the lower point.
On the bone.
Yeah, on the bone. Like this, you
So
have
that
to
means the
oblique
point
up.
will go down.
Yeah. So
The
that is,
point will shift down.
no, it won't shift down. The point, in
Oh,
that case, the injection point will shift down, of course.
shift down. How much? Normally, how much?
Or by maybe 2 millimeter to 3 millimeter, 2 to 3
2
mm.
to 3 millimeter. And still you are on the bone only.
Yes,
You're
on the
injecting.
always periosteum, yeah.
What is your angle at that time? 90 degree or some other degree?
45 degrees maybe, not 90, 45 degrees, oblique upwards.
Okay. But even
And
if you are injecting below the mount will still become more prominent.
no,
Will
it
it look,
doesn't
festoon will look
usually.
more?
See, when there is a mound, no. So if there's a mound, the way to go about when we do, they say the only way to deal with this mound is either through radio frequency devices, and number two, through HA fillers. Now, how HA fillers? You uh, inject above and below the mound, so that the skin
Okay.
above and below comes to the surface of the mound. So the swelling becomes a part of the cheek. The mound becomes the part of the cheek. You
Yeah.
level up the skin above and below the mound.
Yeah. Above, below. So that means that CK2, then you divide CK2 into two parts, one above the mount, one below the mount, and
Below the mound, yeah.
below.
Yes.
Okay.
But make sure always on the bone.
On the bone.
And
Yeah.
here also, it's a good idea to do 0.1 only if there is festoon or malar mound. Even 0.2 becomes more, you know. And if there is no festoon, then exactly directly perpendicular on the eminence, 0.2.
Yeah. Got it.
So this provides a very good projection to the cheek and the shortening of the palpebromalar sulcus. So this also gives good improvement in the tear trough area, this area.
Where which sulcus?
Palpebral malar,
So you mean this
tear under eye area.
this sulcus?
Yeah.
Okay.
This area.
Yeah. Yeah, fine. Yeah.
Then there is the anteromedial cheek. Uh, this is the point called CK3. And again, voluma on the bone. Minimum volume is 0.1, maximum is 0.3. Here we can do with a bone, with a needle or a cannula. So if we are using a needle, it has to be a bolus. If we are using a cannula, it has to be a fanning technique. If it is needle, then on the bone. If it is cannula, then subcute. And it's an alert zone. We have the infraorbital artery over here.
Yeah.
Now, why anteromedial cheek is required? Because the maxilla there's maxillary recession with age, and this area becomes flat or maybe concave.
Yeah.
So to bring back the convexity.
Yeah.
So this again will improve the tear trough area. CK3 point.
When you're doing the fanning in CK3, which is the area that you're filling? Are you filling the medial fat pad?
Yeah, we are filling the medial fat pad, this area.
Yeah, the medial fat pad.
Yes. So when we divide the cheek into 4 quadrants, the upper medial quadrant is the area where you do the fanning, this area, in the subcute zone. The entry point of the cannula is the junction of these 2 lines that we draw, Hinder's lines. The junction of the Hinder's line with the micro cannula, that becomes the entry point, and from here you just do the fanning technique.
Yeah.
So while doing CK3, 2-3 things that you have to be careful is that always protect the lower lid and the eye with your non-injecting hand.
Yeah.
Just like in this picture, no?
Yes.
The
Yeah.
non-injecting hand has to support the eye, and it's like this.
So one thing is, like, when we are using needle,
we'll
be going on the bone and it will be most probably a bolus.
Yeah.
More like a lifting effect. And when we're going to subcute, it will be more like increasing the projection and volume.
Yes.
And so when do we choose a needle or when do we choose a cannula? Is there any criteria or you can choose anything that?
So needle is used when we are injecting CK3 for the purpose of improving tear trough. Then we use a needle on the bone 0.3.
Yeah.
But when there is tear trough along with anterior medial concavity, if this if this area is showing a concavity, there is a loss of fat pads. In that case, we can do fanning with cannula.
So when we do the fanning, what is the upper limit and the lower limit of that fanning area?
So the upper limit is the orbital rim.
Achha, orbital rim.
Orbital rim. And the lower
is
lateral nasal.
Lateral nasal?
That line that we drew from lateral nasal to the tragus.
That's a hinders line.
Yeah,
hinders line.
Yes. So this improves the mid-cheek, medial lid cheek junction and softens the tear trough.
Yeah.
Now again, anteromedial cheek, CK3. We can do, if we are doing with voluma, so here it's a misprint. If we are using voluma, then needle. If we are using Wolift with cannula, it is a, with cannula it is Wolift. We don't use voluma with the cannula. This can be a little confusing because here it's shown cannula with voluma. This is not, this we don't do.
Yes.
Because you see, when people do this, when they do juvederm voluma with cannula in this area, when they smile, no?
Yeah.
This area becomes, more prominent. It comes out and it looks very weird. Because voluma cannot place superficially.
Okay, so that means when you are using cannula, then you are using Wolift, not voluma.
Yeah, you're using Wolift or Ultra Plus XC, nothing else. So when we are using voluma with needle, our purpose is to lift the ligament ORL, your tear trough ligament. It is to lift, it is to improve the tear trough. When we are wanting to improve the contouring of that area, then it is lift with cannula.
Yeah.
Now, lower lateral cheek or the parotid area. This is very important in senior age groups. This point, it gives a very good lifting, a very good lifting effect. So here also we can use two products. We can use voluma with cannula. We can use Volift with cannula. We can use voluma with needle, and we can use Volift with needle. And the plane is subcutaneous. So this is one point where voluma with cannula in subcute can be done. This is the, you can call it an exception. Voluma with cannula in subcute.
Yeah.
You can do that. With the needle or a cannula, whatever you're comfortable. So the delivery is always fanning. Fanning technique, structure is subcute, alert zone is parotid gland and parotid duct.
So here again, when we are going, what are the boundaries where we fan? What is the upper limit, lower limit?
Lower limit. So you draw a line just in the preauricular area, that hollowness is there, no? So you have the Hinder's line going like this, right? You draw a perpendicular line from the middle of the Hinder line, right? And from the lower ear lobe, draw another line. So this upper quadrant, the rectangle that we get is the area where you have to do the fanning. So it can be done. If you're doing with a cannula, then 1 entry point, and if you're doing with a needle, then 2 to 3 entry points. So it is just you have to fill that preauricular hollow.
So there's a line, that the one in the Hinder's line that is connecting tragus with the angle of the mouth. Angle of the mouth. There's other lines from the lower and the ear that's going perpendicular, that's going horizontally. So it is forming a triangle.
No, it's a rectangle basically. So we have one line like this. From the middle, we draw another line like this, perpendicular. And then
perpendicular.
And then there's a rectangle that we get. That is a mesetric rectangle we can call. So you divide that rectangle into two halves, upper half and lower half. So upper half you can do with this. The upper portion of the upper half is this area.
Okay. Yeah.
So alert zone. So it addresses the sunken area at the parotid level and preauricular volume loss. And it will lift it has very good effect on the jawline for jowls. And it improves the lower nasolabial also. This point will improve the jowls, the jawline, and the lower nasolabial and nasojugal. All the lateral points, they will give a very good lifting effect to the underlying, concerns.
Yeah. Yeah. Okay, I have one doubt because this word is commonly used, nasojugal fold. Can you just mark where did I always get confused between tear trough and nasojugal, and both look very similar or sometimes?
This is a marinate line. These are the marinate. No, sorry. This is a marinate line. This is a marinate.
Marinate line down.
Yeah. And this is
nasolabial, I understand.
Yeah. So
nasojugal. Nasojugal.
Nasojugal this is the same line that we are addressing, the nasojugal group.
I thought this is nasojugal.
Which one?
The near the tear trough.
Yeah, this sorry, nasojugal, this one.
Which one, and what is the difference between tear trough and nasojugal?
When we in Indian faces, we have that Indian band, Y-shaped band that forms.
Yeah.
So this is the nasojugal groove, and tear trough is just on the orbital rim.
The tear trough is this, and nasojugal is here.
This will be tear trough, right? And this will be the nasojugal. So nasojugal
down.
Nasojugal groove will found the lower boundary of the festoon.
The lower boundary of the festoon is by nasojugal.
Yeah. So this CK4 point, it will give a very good lift in the marinate lines and the nasolabial folds. Lower nasolabial and the marinate and the jawline.
Yeah.
So this is
Yes.
how to the parotid area. So there are some points where you pinch the skin when you're doing the cannula, pinch the skin. When you're doing with needle, lift the skin. So your non-injecting hand is your second brain. Your non-injecting hand is your, your guiding this thing during your procedures.
Yes.
Right. So here one is with the needle and cannula. Needle and cannula. We can use any of the products. So here we mentioned the minimum wall is 0.2 to 1 ml. Here you can inject up till 1 ml also, but that is a bit higher. 0.2 to 0.5 would give you good results. Half syringe each side.
0.2 to 0.5 ml on each side.
Yeah. 0.2 to 0.5 gives good results. See, because when we are injecting, we are not just putting syringes, we are doing the financials also side by side.
Okay.
Then it is submalar area. Now this, as I mentioned, this slide, MD codes is for Caucasian faces. This has been designed. In Indian, submalar region is hardly required. Like I've just done 1 or 2 individuals for submalar. They have some hollowness and they look very weak and emaciated.
Yeah, okay.
Okay. So here, if we are doing it, we can do Voluma or Juvederm Ultra Plus XC. Could be between 0.2 to 0.5. Needle or cannula. If needle with the bolus, or if cannula fanning. Cannula with fanning gives better results because we are injecting in the subcute. If ever you're using a needle, Ultra Plus is fine. Voluma again will be not advisable superficially over here. Although it is mentioned in this slide, but it's not advisable. Because when the person smiles, the smile becomes, it looks strange if you do it with Voluma.
So if somebody has a mound, if you put filler here, will it help the mound to get more evenly balanced out or no?
The malar mound?
Yeah.
No,
Will
this
putting in CK5 in malar mound help?
No.
To make like more, no.
No. Malar mound, the only points that will help are CK1, the upper 1 or 2 points, and then CK3, the lower, CK2 lower or CK3 points, and the preauricular points, CK4. These points can help with malar mound. CK5 wouldn't help.
Okay. And when we are putting in CK5 now, because most people are looking for a V-shaped face, especially younger patients.
So CK5 is
very
not
few people want it.
Yeah.
Yeah. Most people don't want a chubby face. I think it will create a chubby face. CK5 will create more like a chubby face.
Yes, even if they want the chubbiness, I have few individuals, women, who like their cheeks, but they want that chubbiness in the cheek area, not the submalar area, not in this area.
Yeah.
That's why I'm saying for
right.
Indians, this point is not meant for, us.
Yeah.
But if you have, some tourists visiting for injection purposes and all that, in them, they want round faces.
Who want round face?
Caucasians, tourists, if they're coming, from Europe, Caucasian
They
face.
want round face.
They want,
they want round.
They want not round, maybe fuller. They appreciate the fullness in the face because they have long faces.
Okay. Yeah.
So this we can do with needle or a cannula. If needle, product advisable product is Ultra Plus XC.
Okay.
Voluma is not, because superficially when you smile, the smile will get disrupted some way or the other because of that myomodulation. We'll be coming that concept. We will be covering that concept, myomodulation, that whenever you place something beneath the muscle, it will increase the activity of the muscle. Whenever you place anything above the muscle, it will reduce the activity of that muscle. So that is basically myomodulation. So which is why, because all the smile muscles, all the muscles which help us in smiling are in this area, CK5 area. So whatever product has to be used, it has to, give the, does not have to interfere with the smiling aspect of the face. So if we inject voluma superficially, the smile will get disrupted in this area. So this was all about the CK5. Next session, we'll be doing the 3-point tear trough reshape. Any questions that you have regarding this? Like you've been...
No, I've been using these points quite often.
Yeah.
In fact, I've been using CK1, CK2, CK3 or quite a lot, because that's maximum. My filler is maximum work is these only.
But add CK4 also for senior age groups, heavy faces. It will give very good definition to jawline. Like we say, to give a good result in tear trough, CK1 should be addressed first. Similarly, for giving a good jawline, CK4 should be addressed previously.
Okay, yeah, I understand. Yeah.
And it gives a slimming effect to the lower face, which all of us want.
Yes.
Besides lifting. So lifting, because of lifting, it gives a slimming effect. And how does it give? Because the fascia is very tightly, arranged over here. So even if you fill a little, the whole fascia lifts up.
Yes. Yeah. That's right. Yeah, this is clear. I think I have no problem.
Right. So I'm sharing this video with you. The same link I'll be sharing. And if you have any questions, put the questions across in the WhatsApp.
No, that's okay. I'm okay with it. So next time we'll be doing under eye? Yeah.
We will be doing 3-point tear trough. And if we have time enough, then further, points we can discuss.
So is it possible to have next session, or Saturday okay for you or no?
Yeah, Saturday is fine. We can do it on Saturday.
Saturday.
Yeah.
Fine.
Fine.
Thank you. Thank you.
Okay, bye. Take care. Good day.
In threads, are you using the normal cork threads, or you're using the double needle one? I don't know what, Schiller thread or whatever.
I'm using normal.